Welcome back. This is the Big Story segment right here on Business Day Television Breakfast Show. And we turn our focus to the Nigerian health system, which is once again in turmoil as resident doctors embark on a prolonged strike, accusing the government of failing to honor long-standing commitment. The situation has been worsened further as the Joint Health Sector Unions and the Assembly of Healthcare Professionals Association have also down-tooled. As things stand, private hospitals are overwhelmed, leaving patients in trauma, even as families struggle to save their loved ones. Today, we examine why this crisis keeps reoccurring and what it will take to finally stabilize Nigeria's healthcare sector. And joining us on the show today to provide an explanation for action and how it can be resolved is Dr. Mohammad Usman Suleiman, is the national president of the Nigerian Association of Resident Doctors, NARD. You're welcome, Dr. Suleiman.
Thank you and good morning. Thank you for having me.
All right, let's go straight into it. What are the core issues that pushed resident doctors into the latest strike, and which of this remains unresolved today?
Thank you very much. There are myriads of issues. You are aware our ultimatum carried and eventually the strike notice carried 19 items on our demands, which were initially the minimum demands required to suspend the action. NEC, National Executive Council, appraised the situation last week and limited the items to 7 + 1. These outstanding 7 issues, one, is the issue of the entry level of doctors to the civil service. At some point in the last 12 years, it was agreed upon that COMMES 3 will be the entry level for medical doctors, medical officers, and residents into the civil service. Somehow this year, it became apparent that waivers that were being dished out to hospitals to employ doctors came with COMMES 2. That is 150,000 naira less in that salary as an entry level for doctors. We also have the issue of promotion arrears. People have been promoted, medical officers, from 2018, 2019, 2020, 2021. Their promotion arrears have not been paid. We also have salary arrears. These are salary arrears ranging from 4 months to 20 months in different hospitals. University of Ilorin Teaching Hospital, Obafemi Awolowo University Teaching Hospital Complex in Ife, Federal Medical Center in Owo, UUTH in Uyo, Federal University of Health Science Teaching Hospital in Otukpo. You even have Benue State University Teaching Hospital that has a 20-month salary arrears owing the state government. This has remained unresolved. Now, we also have the issue of the professional allowance table. Now, that professional allowance table, 2014, we had a collective bargaining agreement with the federal government, wherein we agreed whenever minimum wage is affected or is adjusted, it affects the basic salary on the COMMES structure. Now, by that, it also affects the allowances on the COMMES structure. From 2019, all the adjustments made to the basic salaries because of the 30,000 minimum wage, the 70,000 minimum wage, and even the 35% adjustments did not affect the professional allowances for doctors. Now, unfortunately, a meager 1.7% was added. Now, let me put this in perspective. It meant that in the last 7 years, the allowances being paid to doctors in Nigeria is about just 45 to maybe 50 or 60% of what ought to be the actual allowance. And we still kept on working. And then this year we woke up, the basic salary is now being reduced by about 150,000. Then when you now juxtapose it against all these promotion and salary arrears that are coming, that are piling up, you now begin to wonder, what frame of mind do you want the doctor to be in? Now, the more germane issue is work hour. What do I mean by the work hour? You come to work Monday in the morning by 8 o'clock. Today is Wednesday. Let's use today. By 8 o'clock, you do your normal civil service till 4. By 4, you're on call. You continue with that call duty from that 4 till 8 tomorrow morning. You now continue your civil service job from 8 to 4. That's 32 hours of work. You now continue with another call. This is the situation in most, not all, most Nigerian hospitals. That then down means that the work you are doing is in excess. Sometimes you can be on those calls for 3, 4 days, 5 days, 1 week. We have doctors in this country that are continuously on call for the entire month. I've given example in FTH Lokoja, the orthopedics department with Dr. Yomi and Dr. Victor Audu. These are living souls that practically are living in the hospital for the entire month. Now, my own treasurer is the only senior registrar in the plastic surgery department of his own hospital. He has been the only one on call since February. You know, so you can imagine the days that you are putting into work, the exhaustion, the burnout. People fall sick, people die, people driving home from after these exhaustive long calls have accidents and have lost their lives. People have collapsed during ward rounds only to realize they've bled into their brains. People have gone home to sleep after this exhaustive call and they never woke up. You know, so you now look at those incentives that are supposed to encourage the worker, the doctor to continue, and you see how it is piling up to a point where you begin to wonder, are you really appreciated? What are you doing? Is this slavery? You know, at some level, doctors are not machines. At some level, that will play. At some level, when you're deciding critical, difficult, complicated cases that require your full attention, at some level, you're bound to make errors. Now, when you make those errors, it's not enough for the laws of man to catch up with you. The laws of God will catch up with you. Then, is it fair for you to allow Nigerians to be exposed to this type of a tired, angry, hungry, frustrated, uncompensated, improperly remunerated doctor is a dangerous doctor? That is the stark reality. Now, juxtapose that against the reality of 5 of our colleagues in Lokoja have been unjustly terminated. They were union leaders fighting for the rights of their members to address some of these issues that right now we are currently on action for. And one panel was formed, one query was given, the next step was taken, albeit questionably, and then they were unjustly terminated. That is a hospital that has 89 consultants, but only 32 resident doctors. And we all know it is these resident doctors that are in the front line of taking these calls and doing these duties. There's also the matter for our professional advancement, the membership certificate, of which the specialist status has been stripped of it. You know, so one wonders what happens to career progression. Now, when you look at all of this, we have engaged government. Discussions have happened. Positions have been taken. We are asking government, let us finalize these processes on what we have agreed on. You know, we've had agreements. Why are these things recurrent? 3, 4, 5 years ago, 10 years ago, we've had agreements on all these issues. There's nothing that we're talking about now that is new. After those agreements, okay, don't go for any action. The last time we were on an action is more than 3 years ago. Don't go on an action, we will sort it out. And then a few weeks, few months down the line, you're still facing the same issues. And then it culminated to this. Now, it's not as if this strike came out of nowhere. Sometimes in September, there was a warning, 2 weeks notice was given. We arrived at the AGM. At that AGM, a 30-day notice was given. After that 30 days, another 1-week extension was given. And it's not as if we just went home and sat down. No, we were running from pillar to post, calling the attention of people who are supposed to handle these issues, to handle these issues. Unfortunately, it has led us here. Now, like I said, there were 19 issues. NEC looked at it and said, okay, this thing is prolonging. Can we make it 7? Can government urgently handle this 7? What are these 7? Reinstate the Lokoja 5. Clarify the entry level. You know, sort out the promotion arrears, sort out the salary arrears. That's 4. Ensure that the membership certificate gets its status. Take care of the upgrade levels. Now, this issue about the upgrade, people who pass their exams, they are supposed to be upgraded to the next available grade level, and they are not. We are now told you have to come to Abuja because of some errors. Now, when you come to Abuja, they are overwhelmed. They don't do the upgrade. People stay for months to even, in fact, there are those more than a year now. They are due for even another upgrade. So they've missed out on 2 promotions. The arrears are still counting, you know. And next said, handle these 7 issues. I am happy we are reporting progress on them. We are in the process of finalizing these 7. And I would hope that when we finalize them, it will be a finality. We will agree on it. Actions will be put to implement. So
right, Dr. Suleiman, before we talk about the process of having to finalize the agreement, I'm glad that you're able to explain to us why the agreements between doctors and government, you know, have consistently have had a breakdown. But let's look at the severe impact of the strike on emergency care, surgeries, and also patient outcomes across public hospitals. You've explained to us why this strike is there in the first place and the impact that it's having on doctors as to why this strike is necessary. But let's look at the severe impact of the strike on emergency care, the surgeries, and also the patients. What are the outcomes across public hospitals?
I think public health experts will agree with me that when you want to deliver healthcare services, two factors are basic in terms of delivering them: infrastructure and then the manpower. When you don't have these, what you're effectively creating is a system that hurts rather than cure. Is a system that breaks down those that are in need rather than help, which is what we have here now. The infrastructure has been upgraded, but the workforce has simply been not protected, not properly compensated, not adequately encouraged to continue working. So what are you creating? Are we really sure that we want these patients to be attended to by doctors who are exhausted, who are burnt out, who are dying by the day? So let's not make it a competition about who suffers more or what is the public health impact. Rather, let us focus on what needs to be done so that doctors will be at the point of executing their duties. Remember, work should work for the worker, not just government. Also remember, the responsibility for protecting lives and properties rests with government. Government is supposed to provide the adequate tools to ensure that we are there. Now, what is the easiest solution to sort out the myriads of problems we have had over 10 years with respect to doctors in Nigeria? Remember, I've quoted this before. We had 25,000 resident doctors 10, 12 years ago. Today, we just have about 11,000. 11,000. What happened to the rest? They've either left or they are in Nigeria, but out of the government system. MSF, an NGO, recently advertised looking for 100 doctors. They got all the 100 doctors. Our own government has advertised over 20,000 positions, of which majority are clinical positions. From January till date, those positions have not been filled. Why? Because the government has not prioritized the welfare of our members. There is what is known as collective bargaining agreement. This is the platform upon which government will sit down with unions and talk about what it is the remuneration will be moving forward. The last time that happened in the health sector and for doctors was in 2014. 3 months ago, it was agreed that we convoked another collective bargaining. And we thank God, government convoked it and said it will last 3 weeks. After the first week, events stalled. This is the third month that collective bargaining has not been met. Some of the demands we have on our list were used as reasons why the collective bargaining cannot continue. It's the same government. Sort it out, then we focus on the collective bargaining. We're not even saying complete the collective bargaining now. Now, let me even tell you another danger. We'll continue the collective bargaining if we are going to continue from now. We will not be able to finish it probably this year. Then next year will come, they will tell us we didn't budget for it. So you have to wait. You have to be patient until 2027. This is how agreements break down. And then you could understand the frustrations. Now sum up all these frustrations that doctors have, and then tell me, do we honestly think that these will offer the best efforts in terms of patient care? Let us not step over the argument and make it seem as if, okay, we've handled this, we've talked about this, now let us talk about the other side of it. It doesn't solve the problem. Now, the Nigerian Association of Resident Doctors has always been a willing partner to talk. After all, the two presidents before me never embarked on these welfare-related issues on strike. They kept talking and agreeing and signing agreements and extracting commitments. Those commitments never materialized. Now, we're at this point. I think it is important we itemize how we finalize. The NEC made it very clear. Sort out, 19 is no longer on the table, 7 is on the table. Sort it out and we move forward.
Are those specific commitments that the government must meet for the immediate call of the doctor strike?
Yes, release the professional allowance table. That has been done. And I appreciate government for doing it. We're still going to engage them in terms of when they will start implementing so that those adjustments, because it's not a salary increment, it's an adjustment of a past error. That table has been released. We're very grateful for that. The entry-level problem, that's the skipping problem. I am sure maybe today, tomorrow, we'll put that to rest. Once we put that to rest, you see that is second issue of the table. We're just waiting for a response in terms of our demand from the Ministry of Health on that. The upgrade issue, we're expecting a letter to get to the Accountant General's office calling the attention of the Director IPPS, so that someone will be assigned to sit down and upgrade all these people. 1 year, 2 years, they've not been upgraded, for them to be upgraded. And then we begin to talk of the backlog of their salary arrears. We're expecting a letter from the Federal Ministry of Health compiling all the promotion arrears, compiling all the salary arrears to the Office of the Honorable Minister for Finance and the DG budget, so that they will give us a payment plan. Look at even what we are saying. We're not saying drop the alerts now in their accounts. We're saying give us a payment plan that we can both agree on, then stand by it. That is issue number 4. We're looking at our 5 members in Lokoja. We are asking for their reinstatement. I don't want to go into the detail. Let's not debate that. A lot of errors went down how they were terminated. We are happy to report that the committee, saddled with the responsibility of reviewing these cases, has submitted its report to the Federal Ministry of Health. Let us see what is in that report. Let us see the implementable parts of those reports. Let us even see how we implement the whole of the report. I am waiting to see the report. I've not yet seen it, but I'm happy to report that they have submitted it. Let us take it to a finality. There's also the issue of the membership certificate. That conversation is still ongoing. That conversation has not progressed significantly by that end. And I think the 7th issue is the issue of the work hour. An advisory has come from the Federal Ministry of Health to chief executives. There are no specifications. Nothing specific has been clearly said in it. It's just said, don't allow them to take prolonged calls and make sure they take breaks in it. We're still looking into that. Even if that is what is on the table, let us take these things to a finality. If we're able to finalize all these things today, the National Officers Committee will have no other option than to call the National Executive Council. Hey guys, you asked us to go after these 7 issues in place of the 19 issues. We have gone after. This is what government has been able to do. Now, if you take it as it is now, they will begin to ask you, okay, what is Ministry of Health's position on this? Has this letter been submitted? When is this arrears going to be paid? Has this calculation complete? So you need a finality to all of that, so that when we move on from all of this, there's no coming back. And I can tell you, coming back to these issues has happened over time. It has eroded trust between associations, not just with our parent body, but associations generally in Nigeria. There's a question of trust between it and leaders in government. So I'm happy to report progress is being made. I won't shy away from that. Let us take it to a finality so that we don't revisit the issues back again.
Finality. I'm actually an advocate for long-term reforms and not the short-term ones. So what would you say would ensure long-term reforms to stable the industrial relations and also totally end the cycle of repeated strikes in the health sector?
To be honest, when we agree on things, if for instance today we finalize these issues and in the MOU we're signing, we write there that NARD, in view of this agreement, will convoke a National Executive Council meeting with a view to suspending the strike or calling of the strike action. It is beholden on us to make sure we live by that, to make sure that the next action we take is to summon the National Executive Council and live and honor what we have signed in paper. In the same vein, people in government, when you agree on something, it doesn't even have to reach the point of signing papers. When you agree, implement them. But you agree on something that is urgent, that requires to be sorted out in a week or 2. You'll be told diplomacy, talk, advocate. You come back 1 month still talking about that issue. You come back 6 months still talking about that issue. You come back 1 year still talking about that issue. Then when you begin to agitate, you're not termed as being irresponsible or unreasonable. So that erodes trust. Do we want lasting solutions? Let us trust each other. Let us be able to hold each other at our own word. For instance, if you tell NARD today in this country that the Honorable Minister of Finance and the Coordinating Minister for Finance, Chief Wale Edun, has said, I will pay you this promotion arrears by January 2nd. I am telling you, NARD will go to sleep. If it comes after January 2nd, I am sure he is going to be able to convince you this is the reason why. So that is the trust needs to be built. It also needs to be earned. Respect is reciprocal. After all, some of the people leading these establishments of government are senior colleagues, they are teachers, they are parents to us. So the relationship is deeper than you thinking we're actually having a fight when we lock ourselves in. No. There's a respect level that we give. Respect is reciprocal. It is earned. Let us learn to trust each other. It's the only appeal I can make as a union leader. I can't begin to imagine that I have the experience to tell government officials, this is how to do your own job. Just the way as a senior registrar in pulmonology, it is only my consultant that can tell me, this is how you do your job. I can't tell them how to do their job. I can only say, let us build on the trust. When we agree on things, let us agree and move together based on what should be our bond.
So let me just throw this question. If the government fails to act to all the 7 things out of the 19 things, we're starting with that. So what next step will the association take? And how can both sides actually rebuild trust for lasting solution? So let's start with, if the government fails to act, like the usual, not adhering to the warnings and, the plea from the resident doctor, what's the next step? What next step would the association take?
If the government fails to address these issues, I doubt that. I think now we're beginning to understand that these issues must be sorted out. But if the government turns out and then not address these issues, I have no option as the leader of the association but to summon the National Executive Council and report the situation of things. I did that last week. When it got to a point, it seemed as if it was even the national officers that were preventing the National Executive Council from reviewing progress. And when we went there and issues were x-rayed, the National Executive Council flogged us as the national officers. What are you coming to us? Nothing has been done here. A few things here and there, nothing concrete. You are coming to someone and tell us what. They flogged us and sent us back out into the field. I warned that will happen, but it was seen as if we didn't want to take any. Now, at this point, if that should happen, we will have to go back to the National Executive Council, who has the constitutional power. That hallowed body has the constitutional power to direct what we do. They will either tell us, these people, they are not serious, so they don't want to solve anything, or let's go back to our work. Or they will say, since they don't want to brought it down from 19 to 7. If they don't want to handle it, we continue. It is entirely up to the National Executive Council meeting. I can't sit here on national TV and dictate that. If I dictate that, you will hear that they have summoned a meeting and they have removed me as president for taking a position that they should take. So I can't really say that now. The only thing is the NEC will decide. Now, with respect to how we build trust, like I said, it's a straight line graph. Once we agree that this is what we are going to do, don't drag it, don't escalate it, don't make it seem as if this is a secondary priority. You now move on to other things. No, let us learn to take each other by. Like I told you, if NARD signs an MOU with the federal government today that NARD is not going to, or NARD is going to reconsider its position, NARD will go and do that. So that tomorrow NARD will not be accused, but you signed that MOU, now you said you're going to look at the strike action, you never looked at it, and you never got back to us. No, it is your word is your bond. This is how to build, in Nigeria, it's important we learn how to build institutions rather than individuals. For us in the medical profession, the word of my teacher, the word of a consultant, the word of a professor of medicine is his bond. That is why when they speak, we listen. Even if they come out publicly to flog you and say all manner of things, you don't respond to that. You only say, this is my father complaining about my attitude. The only thing I can do is go to ask him, Daddy, how do I do better? But those institutions of government also need to do better. When you agree on things, ensure that you stick by them. Ensure that you stick by them so that it doesn't look as if you're just coming to say suspend the strike for the sake of the strike is being removed from the table while the issues still remain.
All right, thank you so much. Dr. Mohammad Usman Suleiman is the national president of the Nigerian Association of Resident Doctors, NARD. Thank you so much for your time on The Big Story.
Thank you and good morning.
And the Breakfast Show continues with the social listening segment after this break. Do stay with us.